Thank you and welcome to the show this morning. The topic this morning is the welfare debate, and we're fortunate to have with us two persons to talk about the welfare debate. Ms. LO'Neal1. Ms. LO'Neal1 is the Executive Director for the Conference on Social Welfare for the state of Tennessee. And with Ms. Moynihan is Ms. Linda O'Neal. And Ms. O'Neal is the Executive Director of the Commission on Children and Youth for the state of Tennessee. And ladies, let me welcome both of you to the show this morning.
Thank you. Appreciate it.
Ms. Moynihan, before we get started this morning, let's have you and Ms. O'Neal give our audience some information about your background and your education and some of the things that were important in your lives in leading you to where you are today. Let's start off with you, Ms. Moynihan, and then Ms. O'Neal will give us a similar kind of information, and then we'll get into your organizations and some of the things dealing with this whole question of welfare. Ms. Moynihan.
I guess I kind of grew up in a system or an environment, you would say, that was interested in these kinds of things because my father was a pediatrician and professor of pediatrics here at Vanderbilt. So I've been in Nashville most of my life. As a young married woman at quite an early age, I did volunteer work at McNeely Daycare Home. And that center, we worked directly with the children and their families at the daycare center. From that, I went on to work as a volunteer in many, many other organizations, including the Council of Community Services and United Way. I say that because I don't have any real formal education in the welfare systems or in exactly what I do. I have been working at it for almost 20 years now, though, as a professional. And prior to that, as a volunteer for about 17 years in the community in a variety of different systems. So to me, it is something that is extremely important. It is a factor, major factor, in the quality of life for Tennesseans.
Very good. Ms. O'Neal.
Thank you. I'm glad to be here today. I'm with the Commission on Children and Youth, and I have a background working in the child welfare system, in juvenile justice, and I've worked with legal services. I am a licensed attorney, and I have a master's degree in public administration. And like Linda, I share a great concern for the quality of life in Tennessee. I came from a very loving and giving family and always had lots of support, and it's very concerning to me that there are many children and many families in Tennessee who are not so fortunate, who are in really distressing circumstances, and they need the support of all Tennesseans.
Very good. Ms. Moynihan, let's have you to talk about the organization that you represent. Now, you are the Executive Director for the Conference on Social Welfare. Now, exactly what does that mean in layman terms, and something that our audience can understand this morning?
All right, we're a statewide, nonprofit membership organization to promote the social and economic well-being of Tennesseans through our membership, which involves, I guess, about 150 agencies of all different types across the state, and about, on average, 1,500 individuals, some of whom represent these agencies, others that just join as individual members. It's quite a well-structured group, in my opinion, for a very low-budget organization. We have 6 different regions across the state. We sponsor fall training conferences in each of these regions. I've just been back yesterday from Johnson City, where our first regional conference this fall was held. We have a big 3-day spring training conference for everyone across the state here in Nashville. We do a lot of advocacy work. I'm a registered lobbyist in the state of Tennessee. Spend a great deal of time, especially January through May, sometimes later, sometimes earlier, at the state legislature. We communicate in numerous different ways. Many of these communications are involved with interesting things that are going on in Washington that will impact Tennessee. Welfare reform and welfare, which we're going to get into in a few minutes, being one of those very important issues. But our agency, as in difference from the Commission on Children and Youth that you'll hear about in a minute, is very involved in broad issues. We're concerned about the aging. We're concerned about health care for all Tennesseans. We are concerned with children and youth, as you'll hear later on, but our mission is really a bit broader, not quite so focused as theirs. So the issues that we follow both in the legislature and at the national scene and in local communities, are very important to local community people.
So you're an organization of